Welcome back to Talk of the Town. We are joined by Renee Bannon. It's so good to spend some time with you. You are with Encompass Rehabilitation Hospitals of Bluffton.
Absolutely. Yes.
Okay, I got it all right?
Yes.
Okay, perfect. We're talking about stroke rehabilitation today. Now, where are y'all located? And tell us a little bit about the organization. Yeah.
Sure. So Encompass Health is actually, we're a part of a large group of hospitals. So we're actually 136 right now nationwide. And so we're located, our OHHI-TV location is 107 Seagrass Station Road, right there on Highway 170.
So on 170, if you're going toward 278, just on the right. Before the Tractor Supply Road.
Exactly.
Yeah.
Exactly. We're right in there. A lot of folks don't know we're there. We're hidden by the trees, of course, but hopefully this will help us get the word out.
Sure. And the focus is now, that's great that you have so many, 136, you said?
Yes.
That's great for continuity of care.
Absolutely.
That is so great for your organizational structure and continuity of care. And when you have a program that works. So tell us a little bit about what stroke rehabilitation is.
Yes. So as you know, probably, stroke effects, it can vary from person to person, and it can be mild or it can be dramatic, but there are quite a few physical and mental changes that can happen and affect someone's everyday life.
Okay.
Some of the physical changes are things like weakness and paralysis on one side of the body. Something like difficulty swallowing or eating or even speaking. But then there's also some mental changes that happen that can sometimes be overlooked that's also important to note. Things like impaired memory or difficulty coordinating and processing thoughts, and even difficulty making decisions. And so stroke rehabilitation really takes an interdisciplinary approach and makes sure that all of those needs and deficits are met so that the stroke victim has the best chance at outcome in their recovery.
Yeah. There is a time factor associated with this, isn't there?
Yes, absolutely.
Yeah, speak on that.
Yes, so it's very important for a stroke survivor to receive rehabilitation immediately following their acute care stay. And the reason for that is actually the brain goes through something, and it actually becomes like a new brain during the first few months after the stroke. Wow. And the brain goes through something called neuroplasticity, but that's just a big word for how the brain is starting to reconnect some of the signals. Okay. And so the time frame, it's important to receive a very specialized therapy program so that the patient has the best chance at regaining some of that function that they had before. And hopefully we can put off some of those long-term deficits and try to go ahead and get them back to living life and regaining some independence.
Sure. Do you want to talk a little bit about what your the program and what it looks like?
Absolutely. So, when I said the word interdisciplinary earlier, and what that really means is, obviously we're a rehabilitation hospital, so we have all three of the therapy disciplines, so physical, occupational, and speech. But we also have registered nurses that are specially trained as well to take care of stroke patients, and they work collaboratively with the therapy team.
Oh, that's
we also have dietitian. That's very important because they're working with speech therapy as well to make sure that the patient has the appropriate caloric intake. Yeah. Exactly. You can't do rehabilitation if you don't have the proper intake.
Yeah, if you're eating nothing but power bars.
That's right. And all of that, we have respiratory therapy. All of that is actually directed by our physician. And so that coordinated care and approach is really what sets us apart from other stroke programs.
And I love that because there are so many nuances that are so easily overlooked unless you have someone keen and well-versed in it and seasoned who can catch those little signs or those little things that might require a little bit further investigation.
Yes. Yeah. And you brought up our company and the fact that we have the advantage of having so many hospitals, and stroke, that particular diagnosis, is one of the ones that we specialize in nationwide. Yeah. And the advantage to having so many hospitals and a company that supports that, and we actually are nationally partnered with American Heart Association, is that we have advanced technology and really state-of-the-art gym that we work through that our therapists have at their disposal to be able to use for our patients.
Oh, that's fabulous. I mean, and that you collect more data when you see the same people going through the same conditions, so to speak. You get, you just kind of expand and grow and become more holistic in your approach and in your practices. I mean, it's very forward thinking. It's wonderful.
Absolutely.
There's always that disconnect between, one side of things and the other. So,
yeah.
What's the best thing to do now? What now? Just stop by, look at your website? Or
Absolutely. So, we encourage those that are currently experiencing a stroke in the acute care hospital, or if you have a loved one, please reach out to our admissions office. The number should be displayed here shortly. But then also, please let your case managers know in the hospital that you'd like to be evaluated by an Encompass Health liaison.
Perfect.
And then I'd like to just quickly add that we are seeing a lot of patients actually being discharged home from the hospital. We can actually potentially admit patients from home. They still have to meet the criteria, but we ask that you reach out to us if you've been recently discharged home from a hospital after a stroke. We can evaluate you to see if you still meet the criteria for our program.
Perfect.
So please reach out if you're experiencing a deficit
Absolutely.
at home.
And it is, rampant. Absolutely rampant. Encompass, Rehabilitation Hospitals of Bluffton.
Yes.
Thank you so much for being with us.
Thank you.
We'll be right back with more Talk of the Town.